Hi there. Today we're going to be covering our teaching plan. So it's going to be myself, Gabby. We have Stephanie with us, Sarah, and Val. We're going to be covering our teaching plan, which is the topic of coronavirus precautions. This will be taking place at the KIPP Center, and the audience is the residents of the KIPP Center. Some objectives that we set forth to our teaching, which can be seen as evaluated at the end of the presentation. 3 to 4 participants will demonstrate proper hand washing technique. That'll be covered by Stephanie. 3 to 4 participants will show how to properly social distance from each other by sitting 6 feet apart. That's going to be covered by me. Each participant will demonstrate how to protect themselves and others by properly coughing into their elbow. That's going to be covered by Val. Each participant will state one way to reduce the risk of infection. That's going to be covered by Sarah.
Hi, my name is Stephanie Bauman, and I'm a nursing student from Felician University, and we are here today to talk about the coronavirus precautions and how to prevent the spread of infection. So the number one standard precaution to stop the spread of infection is effective hand washing. So when you wash your hands, you're supposed to wash them for 40 to 60 seconds with soap and water, especially on soiled hands. Make sure you do not use clean hands to turn off the faucet. I'm going to show you a video to properly wash your hands. Hi, my name is Stephanie, and I'm going to show you how to properly wash your hands.
So I'm going to be covering objective 2, which is the concept of social distancing. Coronavirus spreads from person to person, and this is by means of coughing, sneezing, touching, who might be within that 6 feet distance, and that's how people get infected. One way to prevent spread is through social distancing, which is what the CDC put out and what everybody should be practicing right now. So you can practice social distancing by keeping a distance of 6 feet and more, because within that 6 feet distance is where it can be spread and people can get affected. So you want to avoid close contact with people who are sick. Put a distance between yourself and your community members, especially members who are at higher risk. So if you ask yourself, who is higher risk? Older adults and people with severe underlying medical conditions like heart or lung disease or diabetes seem to be at higher risk for developing more serious complications from coronavirus COVID-19 illness. And in this slide right here, you can see that the person is coughing and they're within 6 feet, so the infection can spread within that distance. So you want to keep a distance of 6 feet and larger.
Proper coughing and sneezing etiquette. With many respiratory illnesses like the flu and coronavirus,
they are spread through little
droplets caused by our coughing and sneezing.
But thankfully, there are a couple ways that you could do to prevent the spread to others and stay safe yourself. First, you want to cover your mouth
and nose when sneezing with a
tissue. After you use the tissue, you want to throw it out
and wash your hands. If you don't have a tissue, you're going to
cough and sneeze into your upper arm like this.
This way, you are preventing the disease to get on your hands and therefore spreading it to others. Using these little tips will help prevent the spread to others and keep yourself safe. Thank you.
Okay, hi guys, I'm Sarah, and I'm going to be talking to you today about another way that you can help prevent the spread of disease, specifically COVID-19. So, everything previously covered is really important, but another important part of preventing disease is being able to recognize the signs and symptoms of disease so you can take that into consideration and tell yourself, oh, okay, maybe I should stay home or in my room instead of going out and potentially spreading it to other people. So it is the first big sign to look for is fever. That is a huge indicator of infection, and if you feel like you have the chills or achy or just generally tired, you should report this to your nurse or CNA so they can take your temperature and assess that. Because if you have a fever, you will definitely want to stay isolated for a little while until it goes away. And then 2 important signs of COVID-19 specifically are dry cough and shortness of breath. So if you're experiencing either one of these symptoms, it's best for you to stay in your room and let your nurse know so you can be further evaluated without spreading it to the people around you. That's all. Thank you.